Hello, everyone who's just entering now. We are a couple minutes before our start time, so you're welcome to trickle in, and we'll start just shortly after 12:30 here. Welcome to our virtual room.
Looks like it's just starting, so you should start seeing attendees coming in now.
Well, I'm just going to be completely blind to all that. Thank you, Dave. I will not be observing any of that. I can see just a couple of faces and presentation. Welcome everyone who's coming in. We'll get started in a few minutes here. Just opened up the virtual room, so make yourselves comfortable. Welcome to those of you just coming in. We will start shortly. We're just waiting for people to enter as the room was just opened a few minutes ago. We'll start just a couple minutes after 12:30.
Did you see the chat from Rebecca, Sean?
Oh goodness, no, I can't see any chats right now.
Oh, okay. It's just, we miss you, Sean.
Oh, thanks, Rebecca.
From Heartland?
Yeah, back home in Iowa.
Yeah.
It's nice to have familiar faces in the crowd, even if I can't see the crowd.
Right. Or at least familiar names.
Yeah, familiar names in the chat.
We did have a question about, is anyone talking? It's looks like someone may have an audio issue because we are talking.
We are talking right now. We just have been not talking the whole time. There were some lag issues that I had with the previous session of not being able to hear immediately when entering the session. But that cleared up after a minute or two. Dave, does it look like we have probably the participants that we'd be expecting?
We're close to 50. We have 49 right now. So I would say let's just get started.
Excellent. Yeah, let's do that. Well, welcome everyone. Welcome to session B of the 2020 PBIS Virtual Forum. First, I want to commend the organizers for putting this together in a brand new format this year. It's not, I think, as everyone would prefer, but certainly the safest way to do it, and thrilled to have you here. This work that we're going to be talking about today is still new to the world of PBIS, and it aligns a lot with the Interconnected Systems Framework. So we'll be touching on a bunch of topics related to that Interconnected Systems Framework as we move through this presentation. We see the work around substance abuse prevention and mental health being very closely tied, and so hopefully you'll see that connection as well. My name is Sean Austin, and I'm a special education PhD student at the University of Oregon. I've got experience both as a substance abuse counselor and as a school psychologist. So this work really connects both of my professional realities together well. I'm very excited to present with my colleague, Dr. John Seeley, here today. John, would you introduce yourself?
Sure. Hi, everyone. I'm John Seeley. I'm a professor at the University of Oregon, and Resource Director for Substance Abuse for the PBIS Technical Assistance Center. So we're pleased to be here today to share some information and some recommendations, and then to walk through a way to vet potential practices or programs to address substance abuse in your setting.
Excellent. Thank you, John. And also a special thank you to Dave Crosby for technical support. So he's not used to being this close to the camera, as it were, but we really appreciate him supporting us in the background. So our objectives today, as we talk about exploring readiness to implement substance abuse prevention programs within a multi-tiered system of support. Our objectives today are going to be looking at current trends in substance use and how it impacts schools. We're going to move on to some recommendations for prevention and mitigation practices. And then we'll be reviewing a helpful tool for evaluating those practices and how well a district or building might be able to implement them. And through that process, we'll be learning about some substance abuse programs and practices and how they fit into multi-tiered systems of support. And so practicing what we preach, going through the virtual forum expectations, it's been reviewed a couple times already, likely in your previous sessions. But as presenters, we promised to have the files tab updated to monitor comments, and then look for some common questions that we can address in the final 15 minutes. We'll be presenting for about an hour today. In the last 15 minutes will be a nice Q&A for us. As participants, we hope that you'll respond to polls and be solution-oriented in your questions. And then keep in mind what you want to take back to your own buildings, developing a shared action plan, a way to turn these sessions into something useful for yourself and for your students. And so they asked that we insert these slides just as a reference. Obviously, you can find us in the agenda tab. That's how you got here. If you do get lost, going back to the agenda tab and my agenda is helpful, because sometimes when you go through and click on different tabs, it can be problematic in that it boots you out. Even the Take Survey button I witnessed in the last session took me away from the session. So just be wary of that, and don't be surprised if that does happen when you click on something that you think is interesting. As far as navigating the session, the join meeting button is how you get here, and the interaction is going to take place along that chat, polls, people, and files. That's where you can find everything interactive for our session. And for today, we're going to ask that you use the chat for engaging with other participants around the session topic. For the Q&A, for asking us questions directly, we ask that you use under the polls tab, asking a question, and then we'll also have a couple polls for you that we'll send out. So again, be careful of navigating away. We hope you don't get stuck, but again, going to that agenda tab is the surefire way to get back. And if you don't have success with that, use the help desk button and someone will support you. So our first poll today is trying to get a sense of what your current efforts are within your school or district to address substance misuse and abuse. So if you can navigate to that polls tab, and should have our question there at the top. The response options are none, you're just contemplating getting started. You've identified some local needs, maybe some partial implementation of some programs, full implementation of specific programs, or sustainment of multi-tiered substance abuse prevention programs and practices. So I'll give a few seconds here for those to tabulate, and John will chime in since I'm unable to see them at the moment.
So far, it looks like most are in partial implementation in terms of the stage they're in. Over 50% are endorsing that response. The next is none. So there's about a third that are contemplating on getting started so far.
Okay.
And I'll just keep monitoring that. I don't know if we're complete now.
Yeah, there is a little bit of lag as far as getting those results back, but overall it works pretty well.
And so, yeah. Sean, no one is in sustainment of multi-tiered substance abuse prevention programs. So 0% there, only 5% are full.
Okay.
And it landed about 52% are partial, 10% have identified the local needs, and about a third are contemplating getting started.
Excellent. Thank you, John. And yeah, that information helps us gear the presentation in the right way. I think we were pretty well on track with what we thought people would have implemented or not implemented yet. There are a lot of practices, and we'll review in some of those recommendations, practices that likely schools are already doing that weren't necessarily targeting substance misuse, but do have the effect of supporting students that are coping with that. Okay. And so we felt it would be helpful for everyone to have a common definition of what substance misuse is. And we're not talking about necessarily a diagnostic criteria here. We're talking about just a broad meaning of having used a substance in a way that is not consistent with legal or medical guidelines, in a way that's problematic ultimately. And even for prescription drugs, it means using without a prescription for a reason other than a condition for which they were prescribed, or using it a higher quantity more frequently or longer duration than prescribed. And so this context of looking at trends starts with, looking at prevalence. And we start with prescription drugs, as we are in a background of being in a public health emergency in the United States has been declared in recent years, specifically with regard to opioid addiction. And here we're looking at data from the National Survey on Drug Use and Health. And it demonstrates that, across age groups, we do have prescription drug misuse. And specifically, when we look at the younger age groups, it seems to be a bit higher in that 18 to 25 year category, specifically 1.5 to 6.5% of youth report misusing substances, including prescription pain relievers, tranquilizers, stimulants. There is some good news in terms of trends. We see that prescription opioid use seems to be on the decline as far as specific to OxyContin and Vicodin, which are prescription opioids. They've fallen rather dramatically since their height in the mid-2000s among 8th grade, 10th grade, and 12th grade students. And then prescription rates have actually gradually declined as well. This is demonstrating the prescription rate per 100 persons of annual opioid prescriptions filled on a yearly basis. So we find that it correlates somewhat with that overall decline, but this isn't quite as sharp a decline as the amount of use among high school students. What we don't see on the decline, however, is pretty alarming, and that's the rate of overdose mortality. We've seen a pretty steady increase followed by a pretty sharp increase with a couple substances over the last few years. This is going up to year 2017. So in the background of having a gradual decrease among some youth substance use, we do actually have an increase in mortality, and that's there's more potent drugs, I think, available, and that's at least partly responsible for it. But overall, this highlights a reason for, even amid some good news, we need to have continued sense of urgency with these mortality rates. So it's important to look at other substances as well. We know that use of tobacco and other drugs is predictive of opioid use, and that prescription opioid use can lead to more illicit substances being used, like heroin or synthetic drugs out on the street. So it's important to know that these use rates are going to vary by area. And as we talk about using the hexagon tool later, John will discuss, it's important to identify what your regional and local needs are, and relying on data that you have at your fingertips to make decisions that way. And so alcohol use trends, this is more about binge drinking, students who have used 5 or more drinks in a row within the past 2 weeks. We've seen a gradual decline over a couple generations there, from starting back in 1975 to 2019. So a gradual decline in that use among high school students. Again, mixing in a little bit more positive news about use rates when we talk about underage drinking there. With tobacco and e-cigarettes, the trend looks vastly different. High school e-cigarette users are using them more often. This is just in 1 year, 2017 to 2018, an 8% jump in those that used it quite regularly. This likely comes as no surprise to any high school administrators in the virtual room here today, but we see that e-cigarettes seem to drive most of the increase, from just 2013 to 2018 here. The other substances appear to be relatively stable. And that bears out when we look at a breakdown by prevalence for the given year here. 2019, e-cigarettes make up 27.5% of the use among the tobacco product use among high school students, followed by cigars and cigarettes. And that topographically looks different from a few years prior, where cigarettes would have been more dominant. But again, this is an environment that schools need to adapt to and recognize. And like I said, I don't think these findings are surprising at all. I think administrators are dealing with this, on a daily basis. And our data show that as well. What you're looking at here is a graph of number of office discipline referrals by substance over the last 7 years or so, up until 2018-19. And this is data that we pulled. It's, I'll say, preliminary, and so not ready for wide dissemination yet, as this is just in terms of raw referrals. It's not adjusted as a rate. But you can see that blue line being office referrals for tobacco, jumping substantially from 2016, 2017, 2018, 19. The last is nearly a 100% increase year over year. And so things to be aware of as we are trying to develop systems that are responsive to student need. And so these trends are obviously going to have an impact on schools and on students. And first of all, we know that students are going to require substance misuse supports. Students who report high risk use report their initial exposure to medical prescription opioids at the middle school level. And as a substance abuse counselor, I can verify this, at least anecdotally. I was a part of many initial evaluations, and across the board, the most chronic users, the ones that have been using the most and for the longest amount of time, reported their initial exposure in middle school. So this was unsurprising to me, and it is something that we need to be aware of when we're trying to program more prevention-oriented practices. And then students are going to need help coping with trauma. Opioid use and other substance use does not only affect students directly through their own use, but family members use, those in their community. And children and family members who use opioids and other substances are going to be at higher risk for a range of problematic outcomes, including developing a substance use disorder themselves, encountering traumatic experiences in the home, such as abuse, and being exposed to the child welfare system. And then families need help coping as well. Their needs can be wide-ranging, but a lot of times we're looking at family structures that have been altered with the loss of a loved one in one way or another, whether that be through needing rehabilitation or an unfortunate overdose. There are going to be shifting roles within the family. Grandparents, for example, might need to take over, and there are going to be generational differences and cultural differences between parenting a child 20 years ago and parenting a child now. And some of that's illustrated in some of the data that I've already shown you. And so we have this idea of how substances are going to impact our schools and what students need. The next is, what do we do about it? And understanding those trends, it's important to emphasize that the fundamentals still apply. And some might need to be expanded, but the basics are here to stay. And when we talk about PBIS, providing a safe, positive, predictable environment, that is very important for all of those factors that we've just described. We need to have a stable environment that students feel welcome in and can come to and access, appropriate education. The PBS framework is also associated, due to those factors, I think, with a reduced rate of substance use in high schools. And beyond that, it also presents a structure on which you can build in other supports. And so I'm going to go through a series of recommendations here. I'm not going to go into significant depth, but I do want to at least touch on each one so that participants can see the wide range of practices that we know to be effective in supporting students. And John will be able to dive in a little bit deeper into how those might fit within your system and what you need to do to evaluate each of these practices. The interconnected systems framework is something I plugged earlier, and it's something that I think goes really well with our work here in dealing with substance abuse prevention, because we're talking, ISF often is conceived as a mental health supportive framework, but folding in behavioral health and substance abuse is not a far stretch beyond that. And the ISF emphasizes integrating services, outside service providers into the school building, so that they might even be internal supports that work with teams directly, that help develop systems that are supportive for students with these needs. And anyone familiar with PBIS is not going to be surprised that a team process is going to be emphasized. Having these experienced staff, licensed staff around substance misuse are going to be key to supporting students adequately, making sure that they're referred appropriately, that their needs are met within the setting, and that if they can be served within the school building for what their needs are, that those are met appropriately in a way that supports them and their families, because this is something that affects broader than just the individual student. We also need to look at expanding our use of data. So again, the fundamental of using data is exactly right on, but what we use for data needs to look a little bit different when we're trying to address substance misuse. School data on substance use is going to be relatively limited, but we can expand looking at discipline data, for example, like we did with the SWIFT data earlier, is one way to identify what are the trends within our building, and what do we need to maybe address more directly, or what can we program for and try to see a reduction in occurrence of. School surveys, including staff surveys and student surveys, are ways to get a sense of what is the use or what is the perception of use. That was used actually in that study that I referenced earlier about PBS seeing a reduction or a differential impact on substance misuse in high schools. But it's also important to measure these, to monitor these measures over time, including like public health data. You can see trends within your community to understand, if you don't have necessarily a lot of evidence of an issue within your building, you can look at the community aspect and understand where our students are coming from, what are they dealing with, and what might we need to program for. And so one aspect of data specifically that we wanted to touch on was screening. And screening for substance abuse is not something that I think is overly common within school buildings today, but it is something that can be helpful in identifying students early who are at risk for substance misuse or have engaged in some already. SBIRT is a model, a process that is used often to support the use of screening and then do something effectively with that screening. It's important that if we do collect this data, that we use it in an actionable way. And SBIRT is a great example of how to do that. SBIRT often uses one of those tools that are listed on the slide there, such as the CRAFT, to identify what risk level students are at. If they're at no risk, they're screened and they move on. But if they're at high risk use, they might be involved in a brief intervention where a counselor, school psychologist, or nurse talks with them briefly about what their use or potential disposition to use is, and how that might or might not make sense for their situation. And those who are demonstrating severe use might be referred to treatment. And so it's important to have those resources lined up, either intervention or referral sources, if you're doing this kind of screening. And the selection of evidence-based practices is, of course, paramount in identifying what is appropriate for you. But that's the sticking with the theme of tried and true methods. There's still no standard evidence-based practices for opioid misuse specifically. So we need to draw on practical problem solving and evidence-based approaches for broader substance use problems. Being broad here is beneficial, and we know that there are curricula out there that support the broader reduction of substance misuse and risk factors with that. Social emotional learning is something that is a growing focus for schools, and it's an evidence-based approach that is included in most substance misuse prevention curriculum. Working on skills like self-management, regulation tied directly to the ability to demonstrate drug refusal skills and that kind of thing without even necessarily explicitly teaching that. Those substance misuse prevention curriculums oftentimes include direct teaching of those skills as well. There's a resource on the PBS website that includes how to teach social emotional competencies within a PBS framework, and I encourage you all to look at that as well. Something that keeps coming out more and more as we think about how the PBS framework works is, we have what seems like these competing initiatives, but we're trying to create a well-rounded student that has the requisite skills to be successful and work well in their environment. And SEL is a piece of that and can be folded in within expectations and again, support this effort of reducing substance misuse around students. Engaging families in prevention is one of the most powerful protective factors that we have at our disposal. Specifically, we know that parental supervision and monitoring greatly serve as protective factors for students. And so the ways that we can support that as a school would be through launching drug disposal efforts, making parents aware that if you have leftover medications, that they don't just lie dormant in a cabinet, that they're disposed of appropriately, because if they're available, there's a possibility that they can be abused. And oftentimes those things aren't monitored very closely anyway. It's very easy to disregard something that is no longer used. Additionally, offering information sessions in collaboration with community providers. This again comes in with collaborating with community providers around what their data say, what use rates are like, overdose rates, those kinds of things. If you can collaborate with community providers to get that information out to parents, you serve to perhaps enhance that supervision and monitoring, because with awareness comes a desire to act. And then after school activities are another way to increase that supervision and monitoring where parents might not be able to provide it if they have to work, for instance. So just providing an additional safe environment for an extended period of time beyond the school day is another way to think about that. And there's a great resource within pbs.org, to plug them again, that highlights how to do family engagement tied to a PBS framework. And so if you're implementing all of these evidence-based practices, we have to track implementation. Tracking implementation over time helps us answer two questions. One is, are we doing what we said we do? And then two, is it having the effect that we hoped it would? The tools that you can use to assess that within PBIS should likely be well known. If some of you are new, as I understand, 60-something% were new to the forum this year. The PBIS Tiered Fidelity Inventory is an example of a widely used tool to track whether or not schools are doing what they intended to, or how far along they are in implementing their PBIS system. It's important to use that effectiveness of behavioral health to assess the effectiveness of behavioral health and substance use interventions. Again, identifying if we're doing it, is it having the desired effect? If it's not, do we need to change it? How do we need to change it? It's an iterative process. And with all of these new evidence-based practices or revamps, we need to make sure that we're training staff as best we can so they're well prepared to meet the new roles or new expectations that they might have. And we're not necessarily talking about, as I mentioned before, adding. We might just be tweaking. So it might be an adjustment of expectations. It might be adding a bit to a curriculum that was already in place, but making sure the staff are well prepared and making sure that our training resources are adequate is very important. So there are additional resources beyond your own school or district that you can rely on. For instance, you can partner with agencies and universities for expertise in implementing new initiatives. Having personnel like that support in-service efforts or perform some technical assistance for you can be very beneficial, having an outside perspective. So I encourage you all to think about, community academic partnerships, for instance, where you're working with the university to work on, hopefully a goal that you've set for yourselves and you're reaching out. John and I have talked about how that participatory research is the way to move forward, I think, for both researchers and for practitioners. And emergency protocols may be appropriate for some schools. It's one of those things that it seems better safe than sorry. There's a reality that we have to deal with, that drug overdoses are happening, and those are unfortunately increasing, as we've seen. So having an emergency protocol in place, having an idea of how to respond, who's first on the scene, and what resources are available on the spot. For instance, opioid antagonists are something that's becoming more widely available, and some schools actually have present in their building in case. And it does seem, like I said, better safe than sorry in that situation. And lastly, a couple more resources just at the end here. Department of Education website has some great fact sheets and resources for schools, students, and families. And then Operation Prevention actually has a great school-based curriculum. It's relatively brief, but the resources are straightforward. They're targeted toward middle school, high school students, and I recommend you take a look at those. The links are included there. There's also a parent toolkit. So if the schools are looking to support parents directly, getting that information out to them, Parent Toolkit supports parents in developing, I guess, a way to approach conversations with their student around substance misuse and being safe. And so we've gotten through those recommendations. Now that you've gotten a sense of what those are, we're going to ask you to reply to us and let us know what recommendation your school or district is most likely to pursue next. And the response options are interconnected systems framework, the screening for substance misuse, social emotional learning, family engagement, emergency protocols, and community academic partnerships. If you can just go to that little polls tab, if you haven't already, and give us a vote. That gives us a sense of where schools are wanting to move next. And given that some of you, a good portion of you have partially implemented something, we're just curious, like what is that next step? And maybe John can chime in, since I, again, cannot see.
Yeah, so the voting is going on right now, and it's looking like the most common strategy or recommendation is the social emotional learning. That's at 53%. That's followed by the interconnected systems framework. So it's nice to see people considering, and that's adjusting as I talk. So I'll make corrections as I go along. There is a little bit of interest in the community academic partnerships, and often those are referred to research practice partnerships. And so linking up with a local university to help with professional development or technical assistance is an important strategy to consider. And so I think we're probably at the saturation point now. And again, it did end up with, it's mostly SEL at 54%, interconnected systems framework at 20%, and then the community academic partnerships at 12%. The remainder are less than 10%, but there were endorsements in each of those categories.
Excellent. Excellent. Thank you all for sharing that. And yeah, social emotional learning, not surprising. That seems to be, I think, one of the most accessible initiatives. And so moving forward with that, yeah, I don't think you can go wrong choosing one of those. So now I'm going to hand it over to John, and he will walk us through the hexagon tool.
Great. Well, thank you, Sean. And I'm assuming you're seeing the slide that says the hexagon tool.
I am.
Okay, so that means we did this swap okay. Before I get into the tool and describing its application, I did want to describe the context. And what I'm doing is drawing upon an exemplar that presented with us at the last forum last year, McKinsey Harrington Bacote. And she's from the Laconia School District, and they've been identified as an exemplar school district for opioid and substance misuse prevention. So it provides a nice exemplar and will allow for some context in the application of the Hexagon tool. And so the school context, several years ago, there was an overdose death that occurred at the school. And that death kind of raised concerns around need, and that those needs were voiced by the community at a shared board meeting. And then also there is some data to suggest that the high schools demonstrated a slight increase in drug physician referrals. What's interesting is in the last year, when McKinsey presented on expulsions, it really shot up. And that was kind of commensurate to what we see in the office discipline referral, where it's really the vaping that is a major issue that schools are facing right now. And so we need to consider all substance abuse prevention when we think about trying to prevent the opioid misuse, given that they're highly comorbid. Early substance misuse leads to prescription drug use and illicit drug use, as Sean described earlier. And so in terms of a tiered approach, and again, this occurred over several years. And so they didn't say, okay, let's implement all these programs at once. And so that's a caveat to be aware of, is when you're considering an initiative, you should only be considering one or a few initiatives at a time and just focus on which ones you can implement with fidelity. And so although there's quite a few supports that we see here at Tier 1 that Laconia implemented, these are across school grades, across buildings, and across time. So this was not all at the same time. One of them is the Botfin Life Skills Training program, and that aligns with SEL, Social Emotional Learning. And that's what I'm going to drill down as an example as we work through the Hexagon tool. They also implemented an exemplar program from SAMHSA, that's the Project Success, which is a high school substance abuse prevention program, and again at the universal level. They also implemented a mindfulness curriculum, the Mind Up. And then, as I mentioned, SEL, this is the Strong Kids curriculum. And then they also included youth-led substance misuse prevention at the high school. So these are some examples of their Tier 1 supports that they've provided and implemented over time. In terms of Tier 2, and again, this is the linkage now with kind of the like the interconnected systems framework in mental health. There's also a focus on trauma-informed curriculum, and that aligns with one of the recommendations around how students may be impacted by the opioid crisis and may have encountered loss. And so having trauma-informed practices are very important, especially in today's context. There's also the Coping CAT, that is a cognitive behavioral therapy approach for reducing anxiety and negative affect. They have a grief and loss program, and also check in and check out, the typical Tier 2 program that aligns with PBIS. In terms of Tier 3, this is where they expanded their teams. And again, the teaming is very important to have expertise who can inform on substance abuse supports. And these would include like licensed alcohol and drug abuse counselors, mental health counseling, and social worker support. And in doing so, they implemented high fidelity wraparound. And this is what the social workers implemented pre-K through graduation. And they received supports from the University of New Hampshire. And so this is an example of a community academic partnership where the expertise was at the university level and could provide some recommendations on how to connect with the community resources that are available. And in addition to that high fidelity wraparound, there's also a very specific program that is a wraparound service called Renew. And that's to help the high school students with emotional and behavioral problems with the transition from high school to career readiness. And so this package represents kind of a tier 3 approach where you're expanding the teams to include the expertise. And then you have some frameworks that help with the connectivity between the school and the community resources. So what is the Hexagon tool? And so Sean presented on that. I just realized too, Sean, that the graphic that we had for the previous slide was the previous year's graphic. There is a new one now, and NERN, this is the National Implementation Research Network. They keep up with their tools, and they have a very nice website that's at the bottom of the slide. It's called the AI Hub, where all these tools are available to help with implementation and sustainment of evidence-based practices. They also have some lessons there that actually walk through the various tools, such as the Hexagon tool. And the Hexagon tool has 6 different dimensions. 3 dimensions are related to the implementation site indicators, including need, fit, and capacity. And then there are also the program indicators in terms of evidence, usability, and supports. And in the more recent version, this was just released in September 2020, they rearranged this from the previous graphic that we showed. So it steps you and walks you around the decision-making process that begins with the need. And so for this dimension, you're asking questions about who the identified focused population or populations are. What are the needs of that population? Was there analysis of data conducted? And so again, you're going to hear us refer to data quite a bit. That data should drive the decision-making with respect to need. And this is where 2 regional differences may come in. So for example, here in Oregon, methamphetamines is more of a problem than opioid misuse. And what is fortunate is there had been a rule change at the beginning of 2020 for grant funding for the opioid crisis was expanded to include psychostimulants such as methamphetamines. And so again, this is where we need to think broader than just the opioid misuse and abuse, but all substance misuse and abuse, especially because there's high comorbidity between the substance misuse and high comorbidity also with mental health issues. And then how do the members of the focused population perceive their need? How are the community members engaged to assess perceptions? And so for the Laconia exemplar, again, it was the recent overdose death several years ago kind of alarmed the community to attend board meetings to say, we need to do something about this. And so this is a perceived need within the community as well as within the school. And if the program or practice is implemented, what could potentially change for these populations? So ideally, you're turning up the protective factors and turning down the risk factors for substance misuse. And then there are different sources that you can use to evaluate need, as we showed earlier. Discipline referrals, that's one source to talk about need. And so clearly on the slide that Sean presented, there is a need to address tobacco misuse, especially due to vaping. And so that's one that says, okay, you know, there are other issues in addition to the opioid crisis that we need to tend to. There's also school risk surveys. I'll show you an example here in a minute. School-wide screenings, such as using the SBIRT, solicited parent focus groups, how to get a listening session and hear from the parents. Community provider enrollment. There's also public health agency data, and I'll show an example of that in a minute. And, you know, are there trends around opioid antagonist deployments? Are we seeing that they're needing to be deployed to prevent deaths due to overdose? So these are just some examples of sources that can provide information regarding the need. With respect to Laconia, they use the Youth Risk Behavior Survey. And in this slide, it's demonstrating that the Laconia district was higher than the state prevalence rates pretty much across the board for all substances. We can see that marijuana is at the highest or one of the highest rates, and same with alcohol in terms of use. At the bottom, this is a kind of a disturbing statistic too, is that a third of the students thought it was easy or very easy to access prescription drugs. Again, hopefully we're seeing these trends reverse over time as the prescribing practices have changed and have become more restrictive. And so we've been seeing some trend lines from the CDC data. Ideally, those would be reflected too in more local data. And here is an example of leveraging public health data around Narcan and overdose statistics. And here it's showing that there were quite a few administrations that kind of increased. 2018, it decreased a bit, but still they're at an alarming level. And there were several fatal overdoses still in the area. So these data really present that there is this need in the community and that there needs to be supports put in place to address this need. And so, as I said, there's an increasing prevalence, higher use across substances. And so this indicates that there is a need for universal tiered concerns with broad substance misuse. It's not just opioid, it's across the board. And then there are elevated concerns about mortality related to opioids. And so there is a need for early detection of opioid misuse, as well as perhaps the deployment of opioid antagonists, such as Narcan within the school, and having those available in case there is an overdose to prevent a fatality. With respect to evidence, this is where we're wanting to know, well, how do we address the need, and what programs or practices are out there that will address the need, and are there research data to demonstrate the effectiveness of the program or practice? What's the strength of that evidence? Are these clinically meaningful effect sizes? What outcomes are expected when a program or practice is implemented as intended? Again, are we hoping to see reductions in some of the risk factors, increases in protective factors, and ideally reductions in the rates of misuse? Is there a practice-based evidence or community-defined evidence to indicate effectiveness? And so this is where sometimes you can find efficacious programs, but they may not have been demonstrated when implemented by endogenous providers or school staff. And so it's helpful to see if there's effectiveness studies where they've actually been implemented by school personnel rather than by researchers. And is there a well-developed theory of change or logic model that demonstrates how the program or practice is expected to contribute to the outcomes? So these are important questions to address when thinking about adopting an evidence-based program. And the sources, they come from peer-reviewed journal articles. These could be from meta-analytic type of studies as well, where it's a study of studies. That's the strongest sources of information. It could be outcomes from neighboring districts that are implementing an evidence-based practice. And so if there are districts that are part of a learning collaborative where you can share what the effects are, what the context and sample and the implementation, that's very helpful. A critical evaluation of the theory. Do you believe that the targets of the practice or intervention is going to actually address the need? Are there regional education experts? Again, this is where the community academic partnerships come in, and they can help with identifying evidence-based programs to recommend, as well as technical assistance in the implementation and training for implementation. And then also there's best practice lists. So the What Works Clearinghouse, there's blueprints. Do you see that the program is identified as a best practice? And that's based on its evidence. So let's take a look at the Botfin life skills training. In terms of the evidence, there are meaningful effect sizes, and this has been established since the mid-'80s, over 30 empirical studies to evaluate the efficacy and effectiveness of the Botfin life skills training program. There has also been cost benefit analyses. And these have ranged, there's been several of these studies, but they've ranged from $1 of implementation cost results in between $20 and $50 in prevention savings. And so it's really important to think about the cost benefit, because some of these programs are costly, but again, they may have a huge benefit. And so looking at that cost benefit is very important. The Botfin life skills training program has broad adoption, not only in the US, but across the world, and has been shown to have sustained implementation. So that's the example of the tier 1 universal supports that one would consider in getting started and putting practice into place to help reduce substance misuse. And then another practice that there was a clear need for is the identification of those who are at risk or are in need of services. And again, this is the SBIRT. It's evidence-based, and often in schools, they combine that with the CRAFT, which is a reliable and valid measure. These are individual administrations, and the CRAFT kind of identifies areas of impairment from use as well. Moving on to FIT, this is a key consideration. And I'm assuming too, from the earlier polls, we saw that a lot of the attendees haven't gotten started really. Well, if you've looked at some of the recommendations, you might already have gotten started and not be aware of it. So if you're already implementing SEL, social emotional learning programs, that is a strategy to prevent substance misuse. And so part of this FIT is looking at kind of resource mapping and a gap analysis, and what gaps do you need to fill. And so again, even though you may not have had a very specific initiative to address substance misuse, if you're addressing mental health issues or these universal interventions that improve social skills and social emotional learning, that can be an effective early first step in trying to prevent substance misuse. And will other initiatives make it easier or more difficult to implement the proposed program and achieve desired outcomes? And so again, this is where if you're already implementing SEL, it may not be too hard to move to the Botfin life skills program, because that does take an SEL approach, but it has very specific modules on peer refusal skills, awareness, the impact of substance misuse on functioning and on the brain. And so that's where thinking about where does this dovetail, and it could be that most of the SEL might be in elementary, not necessarily in middle school. The timing of some of these programs is important to consider. And so when do you implement, and when is the best time to implement prevention strategies? Well, that's before the incidence of the problems and right before the incidence of the problems occur. Obviously, there's upstream prevention, such as early SEL programs that could be in pre-K or even kindergarten or first grade. But there are a lot of strategies that should be reserved for right around the high incidence period, and that'd be right around middle school, where you might want to reinfuse SEL, especially with a substance abuse focus. The information sources, stated goals of implemented behavior frameworks for the district or the school, the priorities of the community, parents and families, and again with Laconia, having the parents attend the board meetings and express their concerns about the opioid crisis. That was a call to action. And then the overlap with other behavioral programs at the building and district level. And so, does it align with the district mission and goals? And in Laconia, you saw a comprehensive set of programs their focus was on holistic readiness and well-rounded citizens, and wanting to address the whole child, not just the academic aspect or not just a specific mental health aspect. It's how do we address the whole child? And so that's part of the mission and goals, and that's how Laconia kind of leveraged their very comprehensive approach. There's community values, appropriate for all students to receive support, and other initiatives. Again, we're promoting multi-tiered systems of support that align with the public health model, primary prevention, secondary prevention, and tertiary level supports. Is there already implemented or other SEL curriculum? Moving on to usability. Is the program or practice clearly defined? What is it? For whom is it intended? What are the core features? And can these components be adjusted or adapted to fit the context? And so that's an important thing to consider, is whether there is adaptability of the program to fit your context. And then, as Sean mentioned, fidelity assessments are very critical. And so do they come with fidelity checklists or approaches to assess fidelity of implementation? The sources, again, these can be from the peer-reviewed journals, from the program website, and the BOTFIN Life Skills program has a very robust website that provides a lot of details around the various sources for usability. And these could also be at state and local education agencies where they might have information on programs to implement. And look for core features that are clearly defined, as we mentioned before, built-in fidelity measures and adaptable components. And so let's take a look at the BOTFIN Life Skills training. The sessions are broken up by topic. It includes a focus on self-management, social and drug resistance skills. It's packaged by grade level and covers all of the grades. Flexible session schedule. So this is where, again, some flexibility to dovetail with the current workflow of the school. There's a parent program, and now there's some remote instruction supports. So in the context of COVID, this is where we have to think about, can you actually deliver some of these programs at a distance? I was pleased to see that the BOTFIN Life Skills training program, they've been releasing new remote learning modules. And so they are trying to be responsive to our current learning environment. And so that's another consideration that previously we didn't have to think about, but in this current context, can you be trained remotely, and can you actually deliver the curriculum remotely? Those are important considerations. With respect to SBIRT, can it be applied to the entire school or selected samples? You might just drill down and do kind of a multi-stage screening approach where it's only those that endorse using that you would do a more intensive assessment, such as a craft, and then the referrals depend on services that are available locally. In terms of capacity, how much does it cost? That's a key consideration. Do you have the funding to support it? Do you have the staffing requirements to support that? And again, this is where you may need to expand the teams and the building teams to include expertise in substance abuse. Does the implementing site have the access to staff that meet these requirements? They may not, so this may require new hires. What administrative practices may be developed or refined to support the use of these programs? And so really understanding your own capacity, because it will do no good to adopt a program that you do not have the capacity to implement. So these are very key considerations as you move forward. The information resources, current initiatives, decision-making teams, substance misuse expertise, technical expertise, and available funding. And so, funding has a board-approved money for screening. Are there state grants that you can apply for? And so these school climate transformation grants. This would be a consideration there that could help with expanding the capacity in terms of being able to purchase some programs. Staff, are there current additional funding for staffing? If there aren't, what do you do? And what about combining with other initiatives and other SEL? And there's a lot of thoughts that go into how do you leverage your current capacity to implement the new initiative. The skills, teachers should be familiar with SEL curriculum instruction, and they may need training to support the additional substance misuse content. The building leadership, they may not be familiar with screening procedures, logistics, and liability, so there would need to be training in this regard, and to support addressing substance misuse at Tier 1. And so do they have the team in place to actually implement and monitor fidelity of the BOFN Life Skills Training Program? And so in terms of supports, I'm sorry, we just talked about the expert who can help, startup costs. So these are kind of a little bit redundant with capacity, but again, these are key considerations. Are there other curricula or resources that are related to the program or practice? Is training and professional development related to the program or practice readily available? Is coaching available for the program or practice? And I know I'm coming up right at the hour. It's going to take me a few more minutes to wrap up these slides, and then we'll open up for Q&A. In terms of information sources, the program website, LEAs, SEAs, academic partnerships, such as the University of New Hampshire, providing support to Laconia, and look for core features are clearly defined. There's built-in fidelity and adaptable components. Okay. So in terms of the BOTFN, the materials are ready for immediate purchase. There is a 2-day training in curriculum for providers. I'm not sure if that training has now moved to remote. I did find that out, but that would be an interesting question to answer. And right now there's no ongoing coaching available after the training. And again, this is where a local community academic partnership can help with ongoing technical assistance. With respect to the SBIRT, there's multiple services that offer trainings. SBIRT is widely adopted in primary care. And so there has been a lot of initiatives in the healthcare field for SBIRT. It's now being recommended for school-based implementation. And so there are a lot of services available to offer the training. One-day workshop available throughout the year. And then there needs to be considerations for the infrastructure to record and analyze screening data. So it doesn't do you any good to screen if you don't do anything with the data and you don't identify those who screen positive and refer them to the appropriate supports that are needed. So what are the decisions here after we've vetted this through the Hexagon tool? Well, we're going to adopt it. It has a streamlined language, or we're going to need to streamline the language between the existing SEL curriculum and the life skills training. We'll need to train all the teachers on the new curriculum and use some of the dedicated SEL lesson periods to include drug resistance and skills sessions. In terms of the Adopt SBIRT, that's going to require training nurses, counselors, and school psychologists on the protocol. We really need to get parent input on this and consent to screen. This is a sticky issue. Conduct additional building-wide screens per year. So it's not good enough just to screen at the beginning of the year. Substance misuse can occur at any time, so it would be better to have multiple screenings. And then to collaborate with local providers to support a warm handoff in the case of referrals. And this would be like the high fidelity wraparound and the Renew program. We did publish a brief that's just getting started on using the PBIS framework to address the opioid crisis in schools. Again, this is a new topic for PBIS, and so we're just getting started with releasing and developing our practice guides and tip sheets. And so there will be more to come, but this one is already available on the PBIS website. we're supposed to put in a plug here for an opportunity to participate in a study. It's a measurement study by IES. So I'm just going to leave this on the screen right now, but let's open this up for Q&A. And I don't know, Sean, if you're seeing, I'm not seeing the polls, and I need to leave this up because I'm going to have to show the evaluation slide at the end. And so I don't know if you have any questions that have been posed for us.
I do. So we've got a couple good questions up, and I'll just start from the top. First question is, does the increase in tobacco office referrals over the last couple of years have anything to do with increased knowledge of educators about the importance of addressing tobacco use from a mental health standpoint, or are there other hypotheses to explain the sharp incline?
Well, that's a good question. It's probably a combination of both. Awareness is going to increase detection, but we do know that the availability and the prevalence of vaping among teens has been on the increase. And so given that increased prevalence rate, I'm assuming that it's probably the combination of increased use among the teens and awareness of what to look for, because vaping can be a very subtle thing. You know, it can look just like a jump drive. And so sometimes you may not be aware that they're actually holding a vape pen rather than, a USB drive. So that's a good question. Do you have anything to add to that, Sean?
No, honestly, I think you nailed it. It's really around, I think they are those e-cigarettes are popular because they are easier to hide. They're more covert, and so I think that is what we can attribute to the wide use. And then, yeah, the increase in ODRs, which of course is a staff behavior there, is likely due at least in part to heightened awareness of what to look for. As exposure increases, more and more, and they're so diverse what they look like. It's enforcement is a bit challenging there.
Right.
All right. So then we have one other question here, and that is, while districts are more open to SEL strategies as a next step, I've noticed in my community that these don't feel like they are done in a meaningful way. And they elaborate by saying tier 1 booster lessons are pretty superficial, and students are more likely to dismiss or tune out. Do we have any suggestions for SEL opportunities that students may be more likely to engage with?
Oh, that's a good question. I don't know, Sean. I'll have to think about that for a minute. Do you have any thoughts off the top of your head?
Yeah, I do actually. So we referenced that SEL brief earlier in the presentation. I'd encourage you to, and anyone else that has questions about like, how do we really build these in? How do we make them authentic and make them more or less a way of just how we do things in our school? And that brief walks through a few ways to build that in. But one example that comes to mind immediately is you build in these SEL strategies as a part of your building's expectations. So for instance, having like a self-management routine of calming down. So whether that be counting or thinking of positive things, like you can have a effectively a neutralizing routine of identifying what your own feelings are, like focusing on a few deep breaths. And that's one way to build it in, as like you build in practice opportunities throughout the year, you use it regularly, and that doesn't require like the same overhaul of curriculum necessarily, but it's just built into how the school how the school and how the students interact and use their skills.
Right. Excellent answer. Thanks.
Thank you. And so that is all the questions that I'm seeing at the moment. And I don't see any at the bottom of the chat, but I think, John, you had maybe, and Katie Pullman thankfully just posted the SEL link in the chat, so feel free to click on that as well.
Right. I was curious of, those who indicated that they're not doing anything for substance abuse after looking at the recommendations. Can you reconsider and see whether you actually have some things that may be in place that you were not aware of? The example is the SEL. And so I was just curious whether there are any of them out there. And again, I should have set up a poll for this, but I didn't do that.
Respond through the chat though, the participant chat, and just respond that way.
Yeah. And I'm not monitoring that, so you'd have to see. But I was just kind of curious if.
Can you restate the question, John?
Would you fill out the poll differently after hearing what the recommendations are that we made? And so sometimes, again, the awareness of what you're currently doing, there could be certain initiatives such as SEL programming that is going to have an impact on substance abuse and would be considered a substance abuse strategy. And so I assume that if we did polling, we should have done pre and post polling.
That would have been interesting.
Yeah, to see if that would change. But that was one question I had thought about, and just looking at the response to the polling.
Well, yeah, I think it's easy with this work to feel like if you don't have anything that explicitly talks about the substances in your school, that you don't feel like you're doing anything about them. But that's just not the case. You have numerous pieces of infrastructure within your buildings and your districts to support students in this domain. And so, yeah, social emotional learning is one great example. I'm just implementing PBIS, providing a safe, supportive environment is another one. So two of them that are relatively easy to check off the box. I think when we talk about, integrating mental health service providers or substance abuse service providers, that's when things feel a little bit harder to implement because there's more steps involved. There's coordinating with other agencies perhaps, or hiring staff that are just not typical for your setting. And so that's where I think people feel like they're not necessarily addressing it, but understanding that supporting protective factors in a preventative way is a great first step.
Yeah. Well, I know it's getting towards the end of the day for the East Coasters. It's kind of feeling that way even for us on the West Coast after a long virtual forum. So we might wrap up a little bit early unless there's other questions. And so I'm going to go ahead and advance us to the evaluation slide. And so hopefully you know how to do this. There's a QR code that you can scan. And it's very helpful to get the feedback from these sessions to know how to refine it, what works, or what can we improve upon going forward.
Absolutely. And looks like Rebecca Carver chatted in that they're currently promoting SEL integration within their schools, along with implementing PBS with fidelity and working with community resources to implement ISF. And she says that she can see how they're working on that in more ways than even she initially thought. So excellent. Thank you, Rebecca, for chiming in, and tell everyone back at Heartland that I say hello.
And with the ISF too, when you're going about implementing that's a good time to think about how to dovetail the substance misuse and abuse programs, and approaches within the ISF. And so I encourage you to think about that, not just focused on mental health, but how to expand that to address substance misuse and abuse.
Absolutely. Well, I don't think I see any other questions popping up. And so I would like to thank everyone for attending our session today. I hope that it was helpful. I hope that the information sparked some interest and some ideas for moving forward with your own initiatives and supporting students dealing with these issues. Please do submit a survey for us to indicate how we did and what more you'd like out of it. We've appreciated your attention today, and wish you well moving forward, and hope that you enjoy the rest of the 2020 Virtual PBIS Leadership Forum.
Great. And thanks, Sean, and thanks, everyone. That will conclude our presentation for today. And so I believe David's going to shut down this Pathable session here. So.
Thank you, Sean and John. Great job. I'll go ahead and end the session now.
Great, thank you.